first we begin with the bulk assessment. Now, bulk assessment, you can just have a general inspection of the muscles, whether there is any wasting, there is atrophy or hypertrophy which is present, and then you do the actual assessment by using the measuring tape. Okay. Now, where exactly would you measure, right? Now, the measurement basically can be done in two ways. So the first is that you select two fixed bony points and then you choose a distance in the midpoint and measure the bulk in the arm, in the forearm, in the thigh, and then in the leg. Okay. Or you have the fixed points and a fixed distance from each point where you can measure. So I'll show you the first method. Isko ऊपर कर लीजिए. अब आप relax बैठिए. So you can choose the two fixed bony points, the acromion in the olecranon, and find out the midpoint between the two and then measure the bulk there. Or you can just choose the olecranon and take 10 centimeters above it and measure the bulk there. Okay, so I'll just show you. So we have the acromion here, we have the olecranon here. So we just measure the distance between the two. We take the midpoint and then we measure the bulk there. Okay. Now the idea is that you should have comparable points on both the limbs. Okay. Because any difference of more than 1 centimeter between the two limbs is going to be significant. Okay. So in the arm, you can choose the two fixed bony points, take their midpoint and measure the bulk there, and use the exactly same point on the contralateral limb because you need to look for the difference between the two limbs. Okay. So this is how you do it in the arm. Now moving forward to the forearm, either you can choose the olecranon and move 10 centimeters below it, or you choose two fixed bony points, either the olecranon and the styloid, like we're going to do here. So we choose, measure them, and then we take the midpoint and we measure the bulk there. And we do the same thing on the opposite limb and measure the difference between the two.